Okay, so that was normal heart sound, normal heart sound. Mitral stenosis. That. Can you hear this? So first is audible, but then you hear not very audible. Mitral stenosis. S1, S2 an opening snap, and then diastolic murmur. And if it were it were systolic murmur. Systolic murmur, yes? You hear it on the apex. You hear it on the apex. Mitral regurgitation. S1 is not very audible because it's hidden behind the, they call it hollow systolic. Hollow means total, complete systole.
Or pansystolic.
Hollow, huh?
Oh, pansystolic.
Pansystolic, the same, pansystolic. And you can also hear S2. I will give you the 1/2 speed. You hear boom, 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 boom. Mitral regurgitation. Mitral valve prolapse. There is also opening click. It's not called snap here, but it is called click. And a slight systolic murmur as well. But it is not hollow systolic. I will give it to you in the 1/2 speed. You can hear that murmur appears only after the click, Dum, dum, dum. Just compare it to mitral regurgitation. Can you hear the duration? It's longer here, yes, but in mitral prolapse, it's not long. It's not long. But essentially, you just need to differentiate systolic or diastolic, and that is all. We are living in the 21st century. We can refer the patient for echocardiography. That's better than trying to just imagine, to guess. Okay, aortic stenosis. Can you hear the pitch? The pitch is harsh. If in mitral regurgitation, the pitch is not so harsh. The pitch is more blowing. But in aortic stenosis, yes, it is more harsh. Just listen to it at 1/2 speed. And can you hear? It is a bit. It's called, sometimes it's called diamond-shaped murmur. Why? Because it slowly grows and then it just goes away. Increasing in the, it's not like, but it is. Okay. Aortic stenosis murmur. Systolic murmur. Why systolic? Because between S1 and S2, and S1 is even hidden behind this murmur. And S2 also is not very audible. You can only hear some bum 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 somewhere in the background of this. And aortic insufficiency. S1, S2, and then immediately boom is S1, then second, and immediately after the second there is S2 is hidden. But you can hear it. Boom, boom, boom. S1 is single. This is S1. Then there follows S2, and immediately after S2 there is a diastolic murmur. This is slow. Usually you listen to this. You hear this. S1, then S2, which is hidden, and then if it were systolic, it would be boom, 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 boom. Systolic between S1 and S2. But here there is S1, then there is a small pause. Yes. Then S2, and immediately after, then there is the diastolic murmur.
Sorry, aortic stenosis was systolic, is it?
Yes. Stenosis systolic. So, aortic stenosis is systolic, aortic regurgitation is diastolic, but mitral stenosis is diastolic, mitral regurgitation is systolic. Once more, mitral stenosis. Dat rush, dat rush, dat rush, dat rush. Mitral regurgitation. Systolic murmur between S1 and S2, and it's even difficult to hear S1 and S2. Aortic stenosis. The same, almost the same, but in mitral stenosis it is more blowing and it is heard over apex. But this one is heard in the second right intercostal space. Aortic insufficiency. By the way, aortic insufficiency murmur can be heard over right intercostal space and also left intercostal space. Yes, it's possible. Even over left intercostal space. Yes. Slowly. There is S2, but immediately after this there follows diastolic murmur. The first sound is S1. Boom. And this is the gallop rhythm. Gallop. S4. It's like a horse galloping. Just listen to it. It is very soft because usually it's heard over failing heart. Failing heart, yes, with heart failure. That is why it is soft. It is usually soft, and you will need to listen to it very, very. Sometimes it is not heard, but it is felt. It is even felt. Yes, like a very slight additional tone, additional sound. Yes, it's very difficult to hear because usually these patients will be failing. Usually you will see other signs of heart failure in these patients. Yes, so not very difficult, you see, not very difficult. Yes, S1.